Okay. Now we have a case. You're notified by EMS that you're receiving a 78-year-old male who collapsed in the garden. His daughter called 911 and immediately started CPR. He was defibrillated 3 times in the field, and he was brought into the emergency department in sinus bradycardia, and his pressure was 88 systolic. So what do you want to do with this gentleman?
ESI level 1. He's post-arrest and will require continuation of the resuscitation. He's also going to be going on a vent and will need drugs.
Absolutely. He's still hypotensive, he's bradycardic, and he's going to need some IV vasopressors, probably dopamine. He may deteriorate back into VFib for all we know, so he is definitely a level 1, and there is really not much more to say about that.